I work with everybody, including all the pharmaceutical companies.
Do you think that he should respond
And
to
the
the letter
insurance
that I wrote?
companies.
Do you think that he should respond to the letter that I wrote requiring him, or asking him, I should say, to be transparent about potential conflicts of interest between TrueMed and CMS and the MAHA agenda? Is that something that he should do, in your opinion, in keeping with divestment? I mean, because you've said, sir.
You wrote me a letter?
He said, sir, you said before.
Are you saying you wrote me a letter?
I wrote Mr. Means a letter asking him to respond. Do you think he should respond?
That's between you and him. As I said, there's been pharmaceutical companies
you
for
said,
generations in the White
Secretary-
House, and nobody complained about it.
Secretary, you said that everybody who works on health policy should follow high standards of radical transparency and divestment. So I've asked him questions about whether he's done that. Should he, in keeping with what you just said at the top of this, should he be radically transparent?
Let me ask you this. Have you accepted $400,000 from pharmaceutical companies?
Welcome back, America, to Right View Nation, where we pull NO punches, and we're not afraid to call out the rod in the system, no matter who it offends. Today's episode is fire, folks, because we just watched a takedown so righteous, so transparent, that the DC swamp creatures didn't know where to run. Let's talk about something most politicians are terrified to address: corruption in healthcare. The revolving door between big pharma, government experts, and private investors. But guess who just threw that door wide open and exposed what's behind it? That's right, RFK Jr. Now listen, you can say what you want about RFK Jr., but when it comes to standing up to the deep-rooted pharmaceutical interests and calling for radical transparency, the man doesn't flinch. He's standing up and saying what millions of Americans feel, that our healthcare system is a rigged casino and Big Pharma holds all the chips. And let me break it down for you.
For 5 minutes of question.
Good afternoon, Secretary. You've emphasized throughout your career concerns about corruption and conflicts of interest in healthcare, yes?
About corruption in healthcare?
Yes.
Yeah.
And you've pledged during your confirmation hearing and then again today, quote, radical transparency, yes?
Yes.
Yes. And you explained to my colleague from New York that you divested yourself, yes?
Yes.
And you fired the 17 members of ACIP because you think they have conflicts of interest, yes?
Yes.
And do you think that everybody within Health and Human Services at a senior level should hold themselves to a standard of radical transparency and divestment?
Well, I'm going to hold them to that standard, but
So not everybody should hold themselves to a standard of
yeah,
radical
everybody, and the OGE makes them all divest.
So everybody should divest and everybody should be radically transparent. Who works for you?
Yes.
Yes. And does that include people who have involvement in Health and Human Services policymaking, even if they're not in your department? Would you want them to be radically transparent as well?
I don't have any control over anybody except those in my department.
Well, I think you do. Let's talk, though, about how radically transparent you have been to date, because I want to ensure for the American public that they're getting what you pledged. Mr. Kelly Means is a special government employee. He's also a White House advisor. You know him well. He actually introduced you to Donald Trump. And he's the founder and the owner of TrueMed. Now, TrueMed is a company that sells saunas and supplements and maybe medical devices that you described to people with using pre-tax dollars. And he has described his mission as routing federal funds away from health insurance programs towards these health savings accounts. Now, Mr. Means has tremendous influence over Medicare and Medicaid based on the executive order on Making America Healthy Again and the One Big Beautiful Bill, which both call for the expansion of HSA usage for these wellness and supplement products. So that's a direct revenue stream for his company while he's working in the government. So my question is, would you require Mr. Means to sign the financial disclosure forms that you're very familiar with?
I have no power to do that, but I find it interesting that you bring that up.
I'm going to reclaim my time.
Pharmaceutical companies have been in the White House for generations.
This is
none of you
my time,
about
Secretary, my time. Would you require, in keeping with radical transparency, that this individual who you're very close with, who has a major role in shaping MAHA agenda, and you have said so yourself publicly and many times, would you require him, before working on the MAHA agenda, that he sign those disclosure forms?
I have no power to require that. I can require people in my agency, and I've done that.
Will you continue to work with him if he does not sign those forms?
With
Mr. Means, will you continue working with him if he does not sign those forms?
I work with everybody, including all the pharmaceutical companies.
Do you think that he should respond to the letter that I wrote? Do you think that he should respond to the letter that I wrote requiring him, or asking him, I should say, to be transparent about potential conflicts of interest between TrueMed and CMS and the Maha agenda. Is that something that he should do, in your opinion, in keeping with divestment? I mean, because you've said, sir.
You wrote me a letter?
He said, sir, you said before.
Are you saying you wrote me a letter?
I wrote Mr. Means a letter asking him to respond. Do you think he should respond?
That's between you and him. As I said, there's been pharmaceutical companies
you
for
said,
generations in the White
Secretary-
House and nobody complained about
Secretary, you said that everybody who works on health policy should follow high standards of radical transparency and divestment. So I've asked him questions about whether he's done that. Should he, in keeping with what you just said at the top of this, should he be radically transparent?
Let me ask you this. Have you accepted $400,000 from pharmaceutical companies?
The reason you know that is because I have financial disclosure forms, and I'm asking him to submit the same thing. So should he do the same thing? Because when he doesn't, let's talk about what happened. Let's talk about Mr. Brad Smith.
Should you be prevented from accepting money from pharmaceutical companies? Because it says here you've accepted $400,000.
Mr. Kennedy, you asked Ms. Ocasio-Cortez, how did I do that when she talked about the higher rates given to the Medicare Advantage organizations? I actually have an answer for you. How did that happen? The answer is Mr. Brad Smith. So he was in charge of Doge Healthcare, and his biggest investors at his company, Main Street Health, are the Medicare Advantage organizations, the 5 biggest health insurance corporations in America. They're his investors. He owns this company. They own him. And while he was there, he set the rules and reimbursements for CMS to hook up his investors. So I'm going to answer the question that you asked Ms. Ocasio-Cortez. It is because of conflicts of interest. Do you think that CMS should continue to do business with Main Street Health under your watch? Is that radically transparent?
Are you saying that we should cut Medicare Advantage?
Do you think that Main Street Health should continue to do business with Medicare and Medicaid given the conflicts of
Are you
interest?
saying we should cut Medicare Advantage?
Mr. Kennedy, your dissembling and diversion distracts from the fact that you refuse to be radically transparent with
He
either
didn't give
Mr.
any
Means or Mr. Smith. I'm going to enter for the record now documents
You didn't give any money to
substantiate these
United.
claims. Auchincloss oversight letters to Means and the Board of TrueMed and Main Street.
Without
Secretary's
objection,
All submitted.
the gentleman's time has expired. The chair now.
RFK Jr. didn't just talk the talk, he walked it. He fired 17 corrupt advisory board members. Why? Because they were entangled with pharmaceutical companies, pushing policies that line their pockets at the expense of our health. And then, this is where it gets even better. He's being asked about this guy, Kelly Means, a man embedded in the health policy world, profiting off of medical savings accounts while writing the very policies that benefit his business. Sounds like a conflict of interest? That's because at IS. But the swamp doesn't want to admit it. They want to normalize it. Boom. Right there. Did you catch that? RFK Jr. stands his ground. He says he has no authority over outside players, but when it comes to his agency, he demands accountability. That's leadership, folks. That's what we've been missing in Washington. And here's the irony. The same people demanding transparency from RFK Jr., who already released his financials, are the ones ducking behind corporate lobbyists and hiding their own dirty dealings with Big Pharma. They tried to accuse him of hypocrisy, but he flipped it right back. He said, I did disclose. I did divest. Now where's your transparency? Let me ask you, America, why is it that the people who are supposed to protect your health are the very ones selling it to the highest bidder? Medicare, Medicaid, health policy. It's all being auctioned off to pharmaceutical overlords while our elderly suffer and our children grow up sick and overmedicated. And then there's Brad Smith, the guy who literally ran CMS and set reimbursement rates for the benefit of his own investors. You heard that right. The same man whose private company is backed by the biggest insurance corporations in America. And what did he do? He tweaked the system to help them profit while pretending to work for you. This is the swamp in action. This is why nothing changes. This is why healthcare costs keep going up and quality keeps going down. Because the system is infected with conflict of interest, and guys like RFK Jr. are the rare few who are willing to go in and do surgery. So here's our message to the unelected bureaucrats, the pharma puppets, and the fake watchdogs in D.C. We see you. We see what you're doing. And we stand with the patriots, like RFK Jr., who aren't afraid to rip the mask off the corruption. We want real healthcare reform, not another handout to Pfizer or Moderna. We want radical transparency. And if you're not willing to divest, to disclose, and to serve the people, you better get the hell out of the way. This is Right View Nation, where we don't worship the system, we challenge it. And we back the Americans who have the guts to tell the truth. Like, share, and comment below if you're ready to take back control of your healthcare from the swamp. Subscribe for more fearless, unapologetic commentary. Patriot voices only. The truth lives here.